You're listening to the American Interest Weekly podcast with me, Richard Aldous. The US Centers for Disease and Control and Prevention reported a worst-case scenario, a patient who had died from a superbug that was resistant to all FDA-approved treatments. Drug-resistant superbugs have long been a concern, but what exactly are the dangers of a superbug pandemic and how can we prevent them? On the line is Kadayali Srivatsa, a doctor, inventor and publisher who has worked in acute and intensive care in UK hospitals. He has a new essay on superbugs on theamericaninterest.com. Dr. Srivatsa, welcome to the show.
Thank you very much.
So you've come up with a free app to help identify infected individuals early on. Tell us a bit about that.
The past few years, doctors have been labeling infections in a different way. If you go and see a doctor tomorrow with sore throat, one doctor will tell you got tonsillitis, the other one will tell you got virus infection, the other one will tell you you have upper respiratory tract infection. If you cough, they'll say, oh yeah, you got cough, you got chest infection. What do you mean by chest infection? Chest infection does not start actually with a cough. It starts with breathlessness because that is called pneumonia. So if you say, oh, I got cough, you take an antibiotic. That's not the way to do it. How can I change the doctor's behavior? There is no systemization of healthcare at all. Whatever happens in my room, only patient and I know. Dr. Maya helps us to standardize care. In other words, the doctor app, they have to commit. These are the infections I'm going to treat. And the patient can access that. So they don't have to come in contact with the patient. And in the meantime, all the symptoms are explained so that patients can understand what cough means, what are the possibilities. And the patient prepared before they speak to a doctor. So a doctor says, oh, you've got chest infection, come over to the clinic, I'll give you an antibiotic. The patient will turn around and say, no, wait a minute. I'm getting morning cough, afternoon I'm fine. So do you mean to say I've got chest infection only in the morning? So I am educating the patient.
So and so this is an app for individuals. Where could people download it from?
They can download it from. They can also download it from iPhone app stores, and it's free.
And it's called.
It's called Dr. Maya, DRMAYA with a space.
Well, you can read more on superbugs on theamericaninterest.com, including that new essay by Dr. Srivatsa, Superbugs, Pandemics and How to Prevent Them. But for now, Dr. Srivatsa, thanks for joining us on the American Interest podcast.
Thank you.